911, what's your emergency?
You have to help us. He's bleeding. Oh my God, Sam!
Miss, please calm down. Please state the nature of your emergency.
There's been a crash. They're hurt. You have to help them.
We're dispatching units to your location. Please stay on the line until they arrive.
In a world where regrets are common,
I was ignorant to a lot of little things that nearly cost me my life.
I was scared with a lot of emotions running through me.
When I tell people I'm a survivor, they need to know what made it possible.
Welcome to the Dr. Vine Show, a podcast for people of all ages, highlighting and discussing health and well-being in grand style.
The COVID-19 has been a respecter of no man and no country, no continent. It has been that sort of disease that forced countries to shut down, lock down economies, leading to an impending global recession. As countries gradually open up their economies, and more people trying to risk it all in order to survive, what are the treatment modalities currently available to someone exposed? Certain countries too have advised anyone who shows mild symptoms of the COVID to remain at home until severe. So if you're listening to this from your bed, from the comfort of your couch, you'll be wondering what you're going to do to heal up fast. You've tuned into Good Health, and we shall get right to that now.
DICU. Listen to the health topics discussed intensively, the very important topics dissected into details. Get informed, stay informed.
There is a good news and bad news. Which is your ear itching for first? The bad news is that there are no drugs approved by the US Food and Drug Administration to prevent or treat COVID-19. The current practice emphasizes on disease prevention and will continue to be emphasized. Now the good news. The good news is that with control measures and supportive care, COVID-19 can be managed and risk of mortality reduced. Having spoken to some healthcare professionals in the front line of COVID-19 management, chances of survival is above 80%. In one of the previous episodes, I talked about having different types and strains of coronavirus. And depending on your presenting symptoms, your method of care differs, and so is not a one-rule formula. Try to speak to a doctor over the phone about your symptoms first. The next important thing to do is to isolate yourself and stay at home. Stay away from work, school, public places, and if you have to transport yourself to the hospital, avoid using any kind of ride-sharing taxis or vehicles or public transportation. What COVID-19 symptom are you having? Feeling feverish? Over-the-counter medications like paracetamol can be of help. The only reason you can break out of isolation is if your symptoms are getting worse. That is why it is absolutely important to monitor your symptoms. Call your healthcare provider if this is happening. Besides isolating yourself from the public, it is necessary to get enough rest while at home, as this helps your body rebuild the immune system. As well, stay hydrated regularly. While coughing or sneezing, cover your mouth always. Wash your hands often with soap and water for a minimum of 20 seconds, or with clean alcohol-based sanitizer. Avoid sharing personal items with other people in your household, and this includes dishes, utensils, towels, and beddings. Medically, what medications do you take? Stock up on your vitamins, not on tissue papers. Vitamin C, 1 gram tablet every day. Vitamin E tablet, daily. Vitamin A, 2000 microgram monthly. Vitamin B complex, 2 tablets daily. Steam inhalation from hot water, twice daily. Zinc tablets, 20 milligram daily. These medications can go a long way in keeping you fit and helping you recover faster from COVID-19. It has been an approved and recommended method to be used for people under isolation, as received from healthcare workers directly facing COVID-19 patients in isolation centers. Along with staying rehydrated, as I earlier mentioned, up to 4 liters of water daily is required. Try to exercise daily in your enclosed space too. That could be by skipping, push-ups, or any form of aerobic exercise. Very doable according to your health status. A lot of medications being taken should be cross-checked by your healthcare provider. When should you discontinue home isolation? If you have not had fever for a minimum of 3 days without taking antipyretics or medications that reduce fever, like paracetamol, and your other symptoms like cough or shortness of breath have gone, and 10 days have passed since when you noticed your first symptom or you did your first positive test. If initially you've done the COVID-19 test, which came out positive, you will need to have 2 negative tests in a row at least 24 hours apart before you'd be able to leave self-isolation. And most importantly, before leaving self-isolation, talk to your healthcare provider. For people with severe forms of COVID-19 manifesting as respiratory distress, admissions into the ICU with supportive treatments like oxygen are necessary to increase chances of survival. And that's all on this episode. We shall continue further on which medications to help recover faster from COVID-19 in the next episode. Always stay tuned.
You are listening to the Dr. Vine Show, the most educative show on the planet.